In this video, we will briefly discuss about worm infestation in children. Coming to the treatment of worm infestation in children. It is better to treat all the household contacts in the family simultaneously in all worm infestations. Especially, it should not be missed in pinworm infestation. Children less than 1 year usually won't have worm infestation. So don't give the anti-helminthic drugs as a prophylaxis because safety and efficacy data of those drugs in children younger than 1 year of age is limited. We will discuss about nematodes, that is roundworms, pinworms and hookworms in this session. Coming to the albendazole. Usually we will not do stool examination as a routine. So we will follow the general lines of management in children. Albendazole should be repeated after 2 weeks of first dose. For children less than 2 years, 200 mg is given orally as a single dose in a day and the same dose is repeated after 2 weeks of the first dose. For children more than 2 years of age and in adults, 400 mg is given as a single oral dose in a day and the same dose is repeated after the 2 weeks of first dose. Albendazole is available as tablet Zental or ABZ or Bandy or Bendex in the form of 200 mg and 400 mg. Albendazole is a broad spectrum drug, so it can be used in roundworms, hookworms and pinworms. The albendazole tablet should be chewed. If the child cannot chew the albendazole tablet, it can be crushed and given with water. It should be remembered that albendazole tablet should not be swallowed neither in adults nor in children. Albendazole is also available as suspension Zental or ABZ or Bandy or Bendex and each 5 ml of the suspension contains 200 mg of albendazole. And coming to the mebendazole. Mebendazole is usually given in the form of 100 mg orally twice a day for 3 days. And the same dose can be repeated after 2 weeks of the first dose. And in adults, 500 mg single tablet can be given as a single oral dose. Mebendazole is available in the form of tablet Mebex or tablet Deworming 100 mg and 500 mg. And it is also available in the form of suspension Mebex or suspension Deworming and each 5 ml of the suspension contains 100 mg of mebendazole. And coming to the ivermectin. Ivermectin can be avoided in younger children less than 5 years. It is given at a dose of 200 microgram per kg per dose as a single dose in a day and the same dose can be repeated after the 2 weeks of first dose. In adults, 12 mg tablet can be given as a single oral dose. Ivermectin is available as tablet Ivermectol 3 mg, 6 mg and 12 mg. It is also available in the form of tablet Bandy Plus which contains albendazole 400 mg and ivermectin 6 mg. It is also available as tablet Bandy Plus 12. That means it contains albendazole 400 mg and ivermectin 12 mg. And it is also available in the form of suspension Bandy Plus. Each 5 ml of the suspension contains albendazole 200 mg and ivermectin 1.5 mg. And next, coming to the levamisole. Levamisole can be given in roundworm infestation at a dose of 2 mg per kg as a single oral dose. And in hookworm infestation, it can be given at a dose of 2.5 to 5 mg per kg as a single oral dose. Maximum dose of levamisole that can be given is 150 mg per single dose. And the same dose can be repeated after 1 to 2 weeks. Levamisole is available as tablet vermisole 50 mg and 150 mg and suspension vermisole and each 5 ml of the suspension contains 50 mg of levamisole. And next, coming to parental palmoate. It can be avoided in younger children less than 2 years. It is given in hookworm infestation at a dose of 11 mg per kg per day orally for 3 days. And it can be given in pinworm and roundworm infestation at a dose of 11 mg per kg. Single dose can be given orally. And the same dose can be repeated after 2 weeks of first dose. And in adults, 500 mg can be given as a single oral dose instead of 11 mg per kg. Parental palmoate is available in the form of tablet Nimocid or Thalmex or Expent 250 mg and suspension nimocide. Each 5 ml of the suspension contains 250 mg of pyrantel pomade. Next, coming to the piperazine. It is used in the roundworm infestation. In children 1 to 2 years of age, it is given at a dose of 120 mg per kg as a single oral dose. And in children 2 to 4 years, it is given as 10 ml per single dose. And 4 to 6 years, it can be given as 15 ml per single dose. And for 6 to 12 years, it can be given in the form of 20 ml per single dose. And for children more than 12 years and in adults, it can be given as 30 ml as a single dose. Piperazine is available in the form of suspension, antipor or avizine or actipar, and each 5 ml of the suspension contains 750 mg of piperazine. And coming to the iron supplementation in children with worm infestation. It should be given in children with recurrent and chronic worm infestations, and in children with history of pica, and in children with anemia. For prophylaxis in children with no clinical anemia, it is given at a dose of 1 to 2 mg per kg of elemental iron. It can be given once in a day, and a maximum of 15 mg per day can be given. If the child has clinical anemia, it can be given at a therapeutic dose of 3 to 6 mg per kg of elemental iron per day orally, and it can be given twice a day. And iron is available in the form of suspension tonoferon and drops tonoferon. Tonoferon contains colloidal iron. Suspension, each 5 ml of the suspension contains 80 mg, and drops, each 1 ml of the drops contain 25 mg of colloidal iron. And it is also available in the form of suspension Orofer XT and drops Orofer XT. Orofer XT contains ferrous ascorbate. And each 5 ml of the Orofer XT suspension contains 30 mg of ferrous ascorbate, and each 1 ml of drops contains 10 mg of ferrous ascorbate. And coming to the prevention of worm infestation. Coming to the common measures that can be taken to prevent worm infestation in children. They are environmental cleanliness and sanitary disposal of human and animal excreta, and drinking safe drinking water, and maintaining food hygiene, that means proper cooking and proper handling of the food, and personal hygiene, especially hand washing, trimming our nails and brushing the nails, and deworming the children between 1 to 19 years of age biannually, that means twice a year, and deworming the entire family simultaneously. And don't defecate in open fields, and don't eat raw vegetables, and don't eat unwashed fruits. Next, coming to the specific measures that can be taken in prevention of worm infestation. First, coming to the hookworms, do not walk with bare foot, only walk with chappals or shoes. For pinworms, tight pants can be weighed in children. And coming to the National Deworming Day. National Deworming Day aims to deworm all the children between the age group of 1 to 19 years. On this day, all the children mentioned in the above age group are given oral chewable albendazole tablet. If the child cannot chew the tablet, it can be crushed and made into powder and given with water. And mop-up is conducted after 1 week of the National Deworming Day. And it is usually conducted biannually, that means twice in a year, on February 10th and August 10th. Children between age group of 1 to 2 years are given half tablet of albendazole 400 mg orally as a single dose, whereas children more than 2 years of age are given with full tablet of albendazole 400 mg orally as a single dose. And coming to the benefits of deworming. It controls anemia in children, and it also improves nutritional uptake of the children. It improves capacity to learn and also improves the concentration of the child. It improves the school attendance of the child. And it also benefits the community by reducing the worms in the environment.